Our topic is about medication error, ways of preventions, and application of PMS.
Hello, good afternoon. This is Mary Jo Yap with ID number 127351237. Our group will gonna discuss on how to present our EMS, electronic medication system, to decrease medication error in the hospital. First, I'm gonna discuss what is medication error. Medication error defined as medication incidents involving the patient which result to harm and injury. There are causes of medication error in the hospital. First is fatigue related to heavy workload in the nurses and other healthcare professionals. Second is increased number of ill patients in the hospital admitted. Third is distorted or unreadable physician order. According to the research and survey, the fatigue related to heavy workload shows 38.3%, and then the increased number of ill patients in the hospital shows 31%, while the unreadable physician order shows 31.7%. There are the causes lead to medication error, and my groupmate will discuss on how to decrease medication error in the hospital.
Hi everyone, my name is Cecilia Belda with student number of 154070221. My topic is about different ways to decrease medication error. One of the most basic and most important ways to decrease medication error is to secure the 6 rights of medications, which are right patient, right drugs, right dosage, right route, right time, and right documentation. In addition, we can also increase the number of staff for proper delegation of work to minimize fatigue. Third, we can also use the electronic medication cardex. Electronic medication cardex is a desktop file system that gives overview about patients' medication informations, which is updated every shift.
My name is Krisha Lorraine and my student ID number is 165997230. There are additional ways to decrease medication errors. First is mandatory training and proper orientation. It is important, especially for the newly hired in one institution and for all the staff to have mandatory training and proper orientation. Second is medication calculation and administration workshop. It is important because there are different routes of drug administration and also for us to avoid making catastrophic errors. Third is computer physician order entry. This is entering and sending medication orders and treatment instruction via computer application. The fourth is double checking and medication reconciliation.
Good afternoon. I am Jerengay Acosta with student number 161362231. Earlier, my groupmates presented what is medication error, its causes, and how to prevent it. To fully decrease the numbers of medication error, we recommend the use of electronic medication system. This specific system provides accurate and updated medication information beneficial for both patient and all members of the healthcare provider. Our system is best applied in medical reconciliation approach. It is to ensure that patient's medication is correct, to avoid omission or duplication of the orders, and avoid dosage errors. When the patient is admitted in the hospital, all his prescribed medication, like its frequency, its route, and dosage, will then be encoded in the system to ensure proper documentation. All throughout the patient's admission, updated or changed medication orders by the attending physician or a specialist will be inserted in the system for all the healthcare team member to have proper access to the data up until the patient will be discharged. In this way, we will prevent medication error, thus ensuring patient safety.
Presented by Acosta Jerengay, Belda Cecilia, Krisha, Yap Mary Jo.